Good afternoon, everyone. Welcome to the second plenary. I am Terry Piggott. I'm a professor at Georgia State University in Atlanta, Georgia in the US, and a methods editor for the Campbell Collaboration. And here's my co-chair.
Hello everyone, good afternoon. I'm Ashrita Saran. I am the Deputy Director with the Global Development Network in the Evaluation and Evidence Synthesis Department.
In our session this afternoon, we have 3 talks that'll focus on research integrity across the whole process of generating and using evidence for decisions. More specifically, we'll hear about, for example, how ethics is integral to making decisions based on evidence. We'll also hear about how evidence synthesis can support and strengthen peer review of primary studies, and also we'll talk about transparency and guidance for the ethical use of AI tools in conducting an evidence synthesis.
Some housekeeping rules here. So each speaker will have 15 minutes. All of you can keep posting your questions through the app, and Terry and I will make sure that we post them towards the end of the session. You will also have an opportunity to ask in-person questions towards the end of all the 3 presentations in this talk. With that, let's move on with our first speaker. I would like to invite Professor Carla Saenz. She is responsible for regional program on bioethics of the Pan American Health Organization. She holds a PhD in philosophy and is an elected fellow of the Hastings Center. She led the development of organization's ethics guideline for Zika and COVID-19, including catalyzing ethical research in emergency. Today, she will be speaking on taking evidence seriously means taking ethics seriously. Carla, thank you.
Oops. Dear all, thank you so much for having me here. As was said, I'm an ethicist, so I don't usually address audiences like you. And I'm really honored to be presenting to you today. Among you are some of the people that have changed the world we do health policies and health decision-making in the world. I think you have championed a paradigm change, so evidence is now not some random picking and choosing of a scientific article, but assessed systematically and rigorously. As an ethicist, I want to highlight that not taking evidence seriously cannot possibly be ethical. There is no way a policy or a guidance can be ethical if it's not based on evidence. But today I want to bring to you a new challenge. There we go. Okay, and this is the challenge for you. I think it's about time for some sort of second wave of evidence-informed decisions. And by second wave, I mean a moment in which we are very careful about not conflating ethics with evidence. And I think 2 characteristics are essential, so we need to get to a point where ethical claims are clearly distinguished from claims based on empirical evidence, and as a second point, that ethical claims are assessed with rigor. So we talk a lot about ethics, but we rarely dive in onto what ethics is as a discipline. Ethics is a discipline that studies value judgments, how we make arguments about value judgments, and we assess those arguments, we improve those arguments, we produce counter-arguments to make those arguments better. So in many discussions about evidence, in most discussions about evidence, it turns out, ethics is taken as some sort of, algorithm, some sort of like technical issue that is at best dictated by a group of experts, or is what is ethical is determined based on some empirical evidence. And it's not like that. So what I want to talk today is about ethics analysis and what is peculiar about ethical claims. I think that we often make the numerous value judgments that are part of the processes to base policies and guidelines on evidence, as if they were some sort of kind of like easy, right? You remember being presented by these exercises at school when we were kids, and it's like, oh, easy, 5 greater than 3, right? So when we're presented with value judgments, sometimes it's suggested that these value judgments are easy, as if we were talking about comparing things of the same nature, right? But you know well, when we do, for example, risk-benefit assessments, which is essentially a value judgment, we're not comparing things of the same nature. We're dealing with things that are fundamentally different. For example, are the deaths of 10 people better or worse than a temporary harm to 1 million? How about if it's 10 million? Which one is better or worse? So it's clearly no algorithm at stake that can help us solve this once and for all cases. So what do we need to do? We need to do ethics analysis, and that's what ethicists can help with. I think some of you may already be thinking, well, this sounds a lot familiar, a lot like the kind of stuff we have to deal with when we do our grade tables, but hold on a second on that. So I want to bring attention to this. Ethical claims, ethical issues, ethical questions are fundamentally different from empirical claims. The question, is racism acceptable, is different from the question, are people racist, or do people hold racist views? The latter is an empirical question. You want to know what people think? Well, go ask them, right? You know better than anyone how to answer that question. But what people think or do not think is different from the question of whether that thing is ethically acceptable or not. That's an ethical question. And that cannot be answered with an empirical question, which only will tell you what people think, which is very useful to know, by the way, but it doesn't settle what people think. So to figure out if something is ethically right or not, what you need to do is you need to produce an ethical argument, scrutinize it, consider objections, counter objections, improve it, and come up with the best argument that's there. Evidence doesn't do that job. Trying to answer an ethical question with empirical evidence is making an error with the method. That method doesn't do the job, because empirical evidence tells you what do we do, what's real, what's the reality of the world, not what we ought to do, which is the realm of ethics, the realm of value judgments. So there are several points in the processes to infuse policies or guidelines with evidence at which we make value judgments. So, for example, we make decisions along the process, right? We make decisions about for example, which endpoints should be considered. We agree on thresholds for interventions. We assess trade-offs between the severity of the disease and the number of affected persons by the disease. We also decide the balance between desirable and undesirable effects, we figure out whether it favors the intervention or the control. We decide what is a favorable risk-benefit analysis. So how much value are we going to give to X benefit for Y amount of dollars? And we also establish acceptable balances of equity. We all know that equity is morally justified, but up to what point we sacrifice a benefit for everybody in order to reduce inequity? That is a moral judgment that needs ethics assessment. It should not be smuggled. It should not be treated as the preference of a group of people either. Then value judgments also pop up in the process when discussing patients or the population's acceptability. And that's a realm where often I see values and preferences conflated. And values and preferences are fundamentally different. Preferences are moral neutral. Like, I may like yellow, you may like purple. But values are morally loaded. And I think that sometimes we talk about values, but we don't give those values the proper analysis that they ought to be given. So just as you've championed with the empirical assessment, with the assessment of empirical evidence, we should do the same. We should aim at the same level of rigor in when we assess these ethical values. Of course, some topics face us with a more directly with the need to assess values of populations. Imagine you're developing guidelines for treating ectopic pregnancies. So in some situations, they're even more salient. But of course, the most important, arguably the most important point in which value judgments appear in the process is when you come up with your final recommendations. So I find it brilliant that Gray distinguishes between the strength of the evidence and the strength of the recommendation. But what does that entail? Well, that means that recommendation is not solely based on evidence. Great. Well, then this other piece, this value judgment, should be treated with the same level of rigor. So that means that the arguments to justify that position should be made explicit. So I want to highlight something that's been mentioned earlier today, which is that to some extent COVID made us think more about these issues, right? We all struggled with the huge level of uncertainty, especially early in the pandemic, and which led to a situation in which there was very limited evidence and decisions had to be made. The role of value judgments in decision-making processes was obviously greater. But what we presented as recommendations very, very often conflated value judgments, ethics, with evidence. And it was not spelled out, hey, how much exactly evidence of what do we have, and what is based on a value judgment, and what is that value judgment exactly? It was presented as a package, right? And, well, then recommendations changed, as they should have, because we produced evidence, the epidemiology changed, so we need to produce arguments for that circumstance as well. But this change of recommendations led very often the public to distrust scientific evidence. And distrust of scientific evidence is bad for health. The motto of the conference is using evidence improving lives. Well, risking evidence is harming lives, I would say. So we have to take this lesson from COVID and make an effort to rigorously and systematically disentangle evidence from ethical arguments. So how hard is that? How possible is that to do? Well, I think it's quite possible. I think that we already have a great processes to assess evidence, and the way forward that I see is integrating ethics on those processes, taking into account the 3 moments that I mentioned are relevant before. So first, I would say, well, let's make a pause as you start a process, when you start the work of the panel of experts. And then, as part of the process, ask yourself, hey, is this claim that we're making based on empirical evidence, or is this a value judgment, meaning that this is an ethical claim? Okay, if it's ethical, what argument justifies it? Do we have an argument? Can we spell it out? Can we openly discuss it? Or is it just this hunch, and which, would clearly not be sufficient? And once we spell the argument, is this the best argument we can make? could anyone object to this argument based on what? And can we refine it based on that objection so our argument is not susceptible to being refuted by that objection? And that's how we'll come up with the best argument. Well, sometimes it gets hard. Sometimes ethicists like me get called to the group to help with the analysis, to help with the justification. And often my colleagues tell me, Carla, I just kind of feel it's the right way to go, but I cannot explain why. Well, you have expertise I don't have, and I have expertise you don't have. So for any given position, we can assess different arguments and we can figure out which one is the strongest, and being very rigorous assessing the strength of the arguments. And as we assess objections and we find out what exactly the best argument is, we'll come up with a strong argument that we are comfortable explaining. So the last point would be to make the ethics argument explicit, to be transparent about what exactly the ethical argument is that we're making. So you as a group of people working on evidence have championed also transparency as a topic. You've insisted on the importance to be rigorous, to be systematic, but also to be transparent with the decisions. Well, let's have transparency include, the duty to be transparent include that part as well. So I think it's something that is, oops, I'm getting the wrong one. I think that's something that is doable. As was said earlier, I work at PAHO, at the Pan American Health Organization that serves as WHO regional office for the Americas. And one of PAHO and WHO's core functions is developing ethical and evidence-based policy options for health. And that is how we see ethics and evidence at PAHO. We see as yin and yang, as two complementary components of good decision-making. Good ethics needs good facts, good evidence. And evidence, to make decisions based on evidence, we need ethical arguments along the process. Failing to rely on evidence is unethical. So I think it is doable. And we at PAHO continue working on that and are currently working on being more specific in the process about the specific arguments and what they would entail, and we're producing some guidance based on that. So this is what we work in, but this is it. Well, thank you very much.